Welcome to Physio Tips with Marrow. I'm your host, Marrow Burnett. And for those of you that don't know me, I'm a board-certified specialist in orthopedic physical therapy and the owner of Australian Physiotherapy Specialists. Today's topic is going to be EDS, or Ehlers-Danlos syndrome. In this video, we're going to give you a working definition of EDS. We're going to talk a little bit about diagnosis for EDS, and we're going to show you footage of a patient with EDS that we treated at our clinic and kind of show you how it all worked out. All right, everyone, buckle your seatbelt and let's get into the video. All right, let's define EDS. EDS is a genetic disorder characterized by hypermobility of the joints as well as hyperextensibility of the skin. It occurs in 1 out of every 5 to 10,000 people. Folks that have EDS oftentimes may have chronic subluxations and dislocations of their joints because of the hypermobility. If your physician suspects EDS, he might do what's called a Beighton scale. Beighton scale is a test that looks at 5 different joints for hypermobility. I'm going to kind of walk you through it. The first one is your 5th finger. Can you hyperextend beyond 90 degrees? If so, you would score a point. Same thing on the other wrist. Can you extend past 90 degrees? Okay, and then we're going to look at thumb opposition to the flexor part of your forearm. Can you get your thumb to the flexor part of your forearm? And again, you would score 1 point for each positive. Finally, we're going to look at elbow hyperextension. Can the elbow hyperextend beyond 10 degrees on each side? If so, you would score a point for each elbow. Then knee hyperextension beyond 10 degrees. And then finally, bending over and touching the floor with your knees straight. You could get a possible 9 out of 9 if you're positive for all of them. For an adult, 5 out of 9 would be considered positive for hypermobility. For a child, 6 out of 9 would be considered positive. If your doctor suspects EDS, they might send you to a geneticist to confirm the diagnosis of EDS. Okay, now that we talked about definition of EDS, a little bit about diagnosis, let's get into our footage of a patient that has hip pain and EDS. Unfortunately, this hypermobility could lead to early onset osteoarthritis, especially in the hip. So in this video, we're going to show you a real physical therapy treatment using specialized manual therapy to give an EDS patient some relief. Okay, let's take a look at the footage and see how she does. Okay, we're going to look at my patient's hip range of motion. She has EDS, and we're going to look at a potential technique to maybe help her improve her hip range of motion. This is her good hip. So let's go all the way into flexions. I'm pretty comfortable that far. We're going to rotate this way. Well, look how much flexibility she has, if you can see that. And then we're going to rotate this way. Pretty good amount of range of motion. Okay, now let's look at the other hip. Come over towards me. Let me know if this feels tight or uncomfortable.
That's all I got.
That's all you got.
That's all I got, and it's painful.
Painful, different than the other side. Okay, let's look at this one.
No.
That's it.
That's it.
Okay, and then we're going to go this way. And that's a bit more restricted than the other side. Okay, we're going to come back in a moment. We're going to do some treatment, and then we'll look at it at the end. All right, we're going to start with a technique to loosen up her internal rotation that was very limited a minute ago. Let me know how far I can go comfortably. Right about there. And back. Was that okay at that range? We'll do that a few times for you.
You can feel it slowly opening.
Slowly opening up a little bit. Good. There we go. Wow. It's starting to let go a little bit.
Your hand on the socket.
That helps.
Yeah.
Yeah, I'm kind of cupping it and holding it in place while I'm moving.
Is it when I like pop out?
Yeah. Perfect. Okay, now I'm going to do a little bit to help with that flexion tightness. How did that feel going that far?
It's not painful.
Good.
Just make it not hurt.
All right. Do that a couple times.
Oh, bless you. Just, oh, bless you.
And God bless you too. There we go. So far, so good? All right, let's try one more direction. that time? I'm not hurting you with the strap, right?
No.
My pressure's okay so far?
Yeah.
Okay. One last one.
He's grabbing on that one.
I got it, okay. Okay, we've done a couple, maybe 2 minutes of manual therapy. Let's reassess and see how she looks so far. Rotate that way. How did that feel that time versus before?
A lot better. Like, look at that.
And we're gonna try this one.
That's not painful.
That's not painful.
That's not painful.
Okay, much better than a second ago. And we're gonna try that way.
That's still painful.
That's still painful.
Not as bad.
The other two were better. This one still has a little bit of discomfort associated with it, right? Okay, we'll do another round and then we'll come back and check it again. Okay, we're back. We've done maybe 2 or 3 minutes of technique to help hip flexion, and we're going to check it out one more time. Nice. How did that feel that time versus before?
A lot better.
A lot better. All right. Thanks so much for being our guest patient today.
Oh, you're welcome.
All right, well, thanks for watching our video on manual therapy relief for EDS hip pain. If you enjoyed the video, don't forget to hit the like button below. And remember, you can subscribe to our channel and receive more videos like this on helpful physical therapy related tips. Thanks again for tuning in, and we'll see you next time. Goodbye for now.